Good day, everyone. I am Dwayne Arzulbeta. I am your reporter for today, and I'm going to discuss about the cystitis. So, cystitis is the medical term for inflammation of the bladder. Inflammation is when a part of your body is swollen and hot, and it can also be painful. So, for the causative agent, the most common causative agent of cystitis is Escherichia coli or the E. coli, specifically uropathogenic E. coli or the UPEC strains, responsible for about 75 to 95% of uncomplicated cystitis cases. We also have the Staphylococcus saprophyticus, Klebsiella pneumoniae, Protoss mirabilis, Enterococcus fecalis, and Pseudomonas aeruginosa. So, for the mode of transmission, the poor personal hygiene, sexual activity, use of urinary catheters, wiping from back to front for females, and holding urine for long periods. So, for pathogenesis, cystitis usually starts when bacteria, most commonly E. coli from the gut, enter the urethra and travel up into the bladder. Once inside, the bacteria stick to the bladder lining using tiny hair-like structures called villi or fimbriae. This prevents them from being washed out by urine. The body then reacts by sending white blood cells to fight the infection, which causes inflammation in the bladder. This inflammation leads to symptoms like pain when urinating, frequent urination, lower belly pain, and sometimes cloudy or bloody urine. If left untreated, the infection can spread to the kidneys and cause more serious health problems. So for the clinical manifestation, we have a strong persistent urge to urinate, a pain or a burning feeling when urinating, passing frequent small amounts of urine, blood in the urine or the hematuria, passing cloudy or strong smelling urine, pelvic discomfort, a feeling of pressure in the area below your belly button or your abdomen, low-grade fever, and the pain during sex. So for the laboratory diagnosis, we have the urine analysis or the urinalysis, urine culture, complete blood count or the CBC, blood culture in severe cases, and imaging only optional if complicated. So for the treatment, we have physical therapy. We're working with a physical therapist may relieve pelvic pain associated with muscle tenderness or abnormalities in your pelvic floor. The next one is the oral medications, where certain medicines taken by mouth may improve signs and symptoms of interstitial cystitis. Next one is the nerve stimulation, the bladder distension, medication instilled into the bladder, the antibiotics were common treatment for bacterial cystitis, and the surgery where surgery can treat cystitis, but it may not be the first choice. So for prevention, we have to drink plenty of liquids, especially water. Urinate frequently. If you feel the urge to urinate, don't delay using the toilet. Wipe from front to back after a bowel movement. This prevents bacteria in the anal region from spreading to the vagina and urethra. Take showers rather than tub baths. If you're prone to infections, showering rather than taking a bath may help prevent them. Gently wash the skin around the genitals. Do this daily but don't use harsh soaps or wash too vigorously. The delicate skin in this area can become irritated. Empty your bladder as soon as possible after sex. Drink a full glass of water to help flush bacteria. And lastly, avoid using deodorant sprays or hygiene products in the genital area, because these products can irritate the urethra and bladder. That's all for today. I hope you learned something. See you on our next discussion, and thank you for listening.